In this session, we'll be looking at two lung specimens. Both refer to cases of lobar pneumonia. However, the first features red hepatization, while the second features grey hepatization. The first specimen was obtained from a 34-year-old woman who has been very pale for the previous year and had undergone a therapeutic abortion for anemia 3 weeks prior to her admission. After the operation, she experienced a sharp pain in the right side of her chest that was associated with breathing. On admission to hospital, she was febrile and had a rapid pulse. Blood cultures showed a pure growth of Streptococcus viridans. She died 6 weeks later. The second specimen is from a patient that was admitted to hospital via emergency, as he was showing signs of pneumonia and meningitis. He died 2 days later. With the first specimen, we can see that the lower left lobe has been completely consolidated, demonstrating lobar pneumonia in the stage of red hepatization. Thin adhesions are also present in the interlobular sulcus, which you can see in this region here. In the second specimen, we can see evidence of fibrinous pleurisy, and the interlobular fissure has been partially obliterated with fibrinous adhesions, which you can see all along this region. The entire lower left lobe has been mottled with grey and airless, representing lobar pneumonia at an advanced stage of grey hepatization.
We will now discuss the microscopic appearance of lobar pneumonia. The slide we see here was prepared by staining a biopsy of the lung tissue with hematoxylin and eosin. At the microscopic level, we can see clear evidence of the main diagnostic criteria for lobar pneumonia, which is uniform consolidation of the entire lobe. This contrasts with the features of bronchopneumonia, whereby consolidation is typically confined to the peribronchiolar regions. In this specimen, we can notice that several alveoli are filled with fibrin, as well as a significant number of neutrophils. The red color of this stage is attributed to the marked congestion of vessels in the alveolar walls, termed red hepatization. At a higher magnification, in grey hepatization, which is the third classical stage of pneumonia, in which the number of neutrophils will start to reduce and the macrophages will begin to supersede them. There is also a reduction in the congestion of the vessels and a clearance of extravasated red blood cells, hence the grey appearance, all characteristics of grey hepatization. Fewer macrophages appear in this slide than we might traditionally observe during the grey hepatization stage. However, we do see the classical reduction of red blood cells and the influx of neutrophils. As discussed previously, the development of bronchopneumonia compared with lobar pneumonia depends on the infectious agent, its dosage, and its virulence, including whether it has a capsule or can secrete exotoxins. And it also depends on host factors, such as the immune status of the host and the immune response and treatment that they receive.